Let's also talk about, I guess, exercises. I told you guys about the McKenzie extensions that I'm friendly with, so to speak. I really like those.
That's the one where you're like
The
this?
press-ups.
Okay.
So did you go through that?
I don't think. Was that last week?
A couple of weeks ago we talked about that.
Didn't know.
Cobra ones?
Yeah, the Cobras. So let's go through some
I know what
cueing.
those are.
Yeah. I'm a big fan of this for like sciatica that goes down the back. I'm a big fan of them. I think there's a way of cueing it a little bit, so I'll give you some of my cues that I think are good. So let's go onto your belly. So actually, you're a little bit taller, so we may have to go on the ground, or we can go on here. But that's I think we should go on the ground here, or we can go on this feet down here. Actually, that'll be better. So what we'll do is we'll lay onto the ground. We'll do phase 1, phase 2, and phase 3. Phase 1, just so you know, we would normally do this on the ground, but just for demonstration purposes, we would go up into here. So let's just bring our arms up to here and just kind of hang out here for about 20 to 30 seconds. See if they can tolerate it.
Trying to keep the flexion as high as possible.
Yeah, and so what we're going to tell him to do is just completely relax your low back. Just hang out here. We're going to just sit here and talk for about 15 to 20 seconds, maybe 30 seconds. And I just want to let you know, we're going to stay here for a little bit. And if you have increase in pain, you just let me know. There's only 3 things that are going to happen in these series of exercises. You're either going to get the same, you're going to get better, or you're going to get worse. That's it. If you get worse, please tell me right away. If you feel the same, that's okay. If you feel better, great job. We'll keep going. So right about now, I'll ask them, how are you feeling? You're like, hey, this feels fine. Okay, let's migrate up. You passed level 1. Let's go up to level 2. Level 2 would be like onto your elbows. I'll call this TV watching position or coloring book position or reading position. Yep. So we'll hang out here for another 20 to 30 seconds. All I want you to do is focus on relaxing your back. I will place my hand on their low back and I'll do this.
Their neck just be like neutral or
Yeah.
extended or just pretty neutral.
If they can pass this, after 20 to 30 seconds, I'll have them come all the way down. After we say all the way down, I'm going to have you do a press up. So what we're going to do during this press up is you're going to press up only to the point where you're comfortable. Some people like to push up as far as they want, as far as they can. I don't care about as far as you can go. I only want you to go as far as you can go till you feel relief of back pain or feel relief of discomfort or you just feel comfortable. You should always be comfortable 100% of the time. I don't care if you go this far, I don't care if you go this far, okay? The number 1 goal you want to do is just relax the lower back, keep the pelvis on the floor. A lot of people will ask me, should I contract my butt? Should I have my feet pointed? Or should I have them? It doesn't matter about the feet, in my opinion. I find that more people actually have more pain when they contract the glutes, believe it or not. It's because I think they're trying to tense up the spine.
Yeah.
Because it inherently has to tense it up, yeah. So I find that people will just relax better. So I'll place my hand here and I'll just have them go up. So try to, there you go. Is that comfortable for you? You don't have to go all the way up, just so you know. Okay, come back down. And back. So you're gonna hold for 1 to 2 seconds. And then what I want you to do is when you push up, try to really focus from here. I say frog on a lily pad, you know, play around with arm positions or something like that. I'll have them do 5 in a row. We're gonna do 5. Push up and come back down. Good. So you're gonna push up, hold for 1 second. Good. Try to relax this the best you can. I'll rock them back and forth.
G-spine extension.
It's really more, it's actually more extension that's being accentuated down in the low back. That's why you're keeping the pelvis flat. And that's why you keep doing this, is so that you really kind of make them keep their belly button, so to speak, on the floor. Even though the belly button does come up, like, but it kind of gives that visual. So once we'll do 5 from here, they'll say, hey, I feel a little better, I don't feel much change. I'd like to at least do it as a minimum of 10 to 20. Absolute minimum is 10. Like 2 sets of 5, just to see how they can do. The second set of 5, I'll tell them to play with hand positions. Can you do a little wider? Can you do it forward? Can you do it back? And all the other things. There should be no reproduction of symptoms at all. To get out of this position, in this we do this on the floor, but I'll have them Superman or Superman out with one arm,
Draw attention superior.
and then just roll to your side. I got you. That's how they'll get out of the position on the floor, and they'll get into like a fetal position and then go back in. Obviously, we're on a table. I don't want that. But so we'll do that again. The next exercise I like is a hip hinge, which a lot of people are. You already know. You probably already know as well, but let's come up. But I'll just tell you how I cue it, and you can kind of come up with your cues. So the first thing I'll do is I'll tell patients to come in. Like we want to. So first, like the first day, I probably will only give them their prescription of this McKenzie extension if I feel like it's necessary for them. I'll do the extension for them. I say you have to do it 4 days in a row, maybe 3.5. If I see them in 3 days, I want you to follow up in 4 days. The reason I say 4 days is because I want to know if I'm changing anything. If they're getting results, then great. Then I know I can go with my next series of exercises. Yeah. And then on day 5, they can kind of completely rest if they want. We'll do whatever they want. But I want 4 days, 20 in the morning, 20 at night. Anything else is a bonus. You can do 5 sets of 4, 4 sets of 5, 2 sets of 10. I prefer not to do 1 set of 20. But if you go on the floor in the morning and you do 20 repetitions, great. And you do 7 in the afternoon, fine. Just make sure you do 20 at night. The reason we do 20 at night and 20 in the morning is because the disc rehydrates and it has a lot of swelling and compression. And that's why most people feel a lot more complaints. So assuming you've done this for 4 days in a row, you're starting to feel a little better, like, holy crap, this actually is working. I'll tell you, after we're done with this, like, sprinkle it in, like 2 to 3 days a week still. We're not done with it, because you still need to decompress it, but you don't need to be as aggressive anymore. I just wanted to make sure I was right.